Hey there, moms of Miami. It's Huang with Hands-On Therapy Services, and this month I want to talk to you and help you with any hand and arm problems that comes your way, whether it's during your pregnancy, after your pregnancy, or as your kids get older. So one common hand and wrist problem that I hear a lot, it's called DeQuervain's, and so it's this tendon right here when you use your thumb and you move your wrist, right? So it's a common problem with moms, especially with new moms having babies. And this is actually, if you have twins, man, it's like a given. It's terrible, but our bodies go through so much stress when we are pregnant. You know, our bodies change and stuff like that. And there's another video where I talk about during pregnancy some common problems, but this is a really common problem after pregnancy. So after you have your baby, you know, during the pregnancy we have all these hormones, right? And if you're a loosey-goosey person, and I talk about people who are loosey-goosey who have a lot of flexibility, they have a tendency to get even looser after pregnancy. So after pregnancy, your body's going to continue producing these hormones that loosen up your ligaments and change your body a little bit. And so what happens is we have a tendency we have to grab the baby, right? We have to hold the baby, we have to feed the baby. And so there's a lot of grabbing and a lot of turning of your wrist, right? Turning of your wrist this way, bringing your wrist up, bringing your wrist down, like any which way you can take care of this baby. It's really gonna start to irritate this tendon. And that irritation is called a DeQuervain's tendonitis. And a lot of people ask me, well, what do I need to do about it first, right? And then if it doesn't go away, what's possible? So one thing that you could do is to wear a brace. It's called a thumb spica brace, and it covers your thumb and it goes all the way down here. You can buy it in the drugstore. The biggest thing is to make sure that your thumb can move. The hardest thing about this is you have a baby to take care of, and that baby requires 24-hour care. And so it's really hard to give your the hand and wrist a break. So my second piece of advice is to ice it. Icing it really does help reduce the inflammation in that area. So bracing first and icing second. Now, the hardest thing, again, like I said, is you don't have a lot of time and it's difficult to wear the braces. So when is a great time to come and get the help? Well, if you tried the bracing and you've tried the icing and it's still hurting you, there's a couple of different options. You can take pills for it, right? You can get injections, or you can wait until it's so bad that when you go to the doctor, they're gonna recommend surgery, right? If you are someone who's looking to avoid having to take pills, avoid having injections, and avoid waiting until it's so bad that you need surgery, we here at Hands-On Therapy Services can help you. We'll make sure that we can talk to you, answer some of your questions, and talk to you about what's going on. So we'll take a look at how you're using your hand, how you're using your arm, and where you might have some imbalances that's causing this type of inflammation, and give you the right kind of help to make sure that you can continue to do the things that you need to do to get rid of the pain in your hand so you can take care of your baby. Because let's be honest, babies only get bigger and they get heavier, and it's going to require you to do even more work. So if you're a mom and you are looking to get rid of your hand and wrist pain without having to take pills, injections, and waiting until it's so bad that you need surgery, then give us a call here at Hands-On Therapy Services.